Hi everyone, this is Dr. Erdogan by Smile Hair Clinic. Today I would like to share a patient's case to explain what we did for him. So I'm starting very quickly to his file. His name is Victor. We did his operation in 2022 July. The operation ended up with 5,000 grafts in total. So he had never usage of a medication. We started directly with the hair transplantation. So I would like to show you the photos first. This is his frontal part. You see that in the central part there are some thin hairs. In the bald temporal part it is receded already, it's totally bald. Once we see from top, you can see that the frontal part is thin until the mid-scalp, and in the mid-scalp also it is very thin, it's not very well desired density. And this is his crown. Crown area seems huge, and also some thin hairs and some bald areas also. So he need probably over 6,000-7,000 grafts to complete his every area. Okay, so we did his plan. According to the plan, I would like to show you by what we did with the hairline. Okay, so in the patients like Victor, we don't want to lower the line. With most of the patients, I don't recommend it if it's not too high, because even we have the enough graft for the crown and for mid-scalp area, patient may need another session in the future. So taking as low graft number as we can take is much better for his future other operations if he need another one. I think it is nearly 8 centimeter from glabella to hairline, which could be little higher for us. We use always 7.5, sometimes 8. If the patient is totally bald and we don't have enough graft number, we take even 10 or 11 centimeter from glabella to the hairline. We discuss it with the patients every time, every day. We ask for their expectation with the line, and we give our recommendations, the realistic recommendations. So we decide together always. Sometimes, yes, patients need different levels of the hairlines, different shapes of the hairlines. We are experienced well. We did many patients so far, so we know how it should be according to his face or his scalp. But patients always want their previous hairlines that they had before. They are showing photos of before, and sometimes they show the other celebrities that they want a similar hairline. We are open to all suggestions, but realistically we also want these hairlines to fit on his face according to his age or according to his maturation. Sometimes I want to clear out one point. Sometimes we do the line like very straight, but we don't stay in the same straight lines. We always do irregularities, small micro zigzags or macro zigzags. Also we use some hairs when designing the hairline. So it doesn't look very straight, or it looks very natural at that point. Sometimes I'm explaining this to patients, but of course I know the result, but patients may not know the result. So we explain in every point to be clear for the patient. Okay, so let's check the frontal part. As you see, frontal part is nearly totally bald. There are very tiny hairs. We still protect those hairs, but of course, most important thing is try to transfer more thicker hairs to grow more. For the crown and mid-scalp, here is the mid-scalp photo that you can see. And crown also I design with its own directions, the existing directions of the hairs. I already do these lines to his scalp. Okay, so we extracted 5,000 grafts and we give the most priority to the front, because we know that front is very important for every man. Sometimes it is different, sometimes patients need crown as well, but mostly if it is receded, we give importance to the frontal part. As you see, you can see by the end photo of the operation, you can see very small different zigzags that gives the naturalness of the hair. The front is dense, nearly 55 follicles per centimeter square with this patient, according to his graft, because his grafts were very thin. That's the reason we sometimes increase the density. If the patient's grafts are thick, we decrease the density, so we cover more areas. We did the frontal part. In this photo, you can see that there was good hairs in the mid-scalp, so we just increased some of them, but we give more prior to the second prior to the crown area. So you can see in this photo that we did more crown area coverage. It's nearly 3000 in the front, and the remaining is used for the some mid and some crown area. Okay, let's see his 6 months photos. Here you can see that his hairline is already defined. It starts to grow. It looks very good even right now. Yes, the density is not very desired, so you can still choose those. Some hairs it's very visible with the front, but it will be thickening in the future after the 7th or 8th month. So you will see in the other photos it's more clearly. When we see from the side, it looks very well designed. He has a very nice haircut as well and style. Let's see his 12th month results. This is from front. It's very thick, good. From top, just I think in the central part of the crown still could be another session done for that part, but I think it's very, very thick and covered. All right, so this is the final result for him. The patient is very happy with us. We are also happy to see his progress and his outcome. Thank you for watching us and have a nice day.